The South African Medical Association says the current R70 administration fee will not be enough to cover logistical and operational costs. Well, the association says some practices will not be able to break even.
So I would like the 70 rand to be increased to about 100 rand to allow, especially those practitioners working in the rural areas, in solo practices, to be able to employ another nurse or extra personnel to help with the rollout of the vaccines. But the doctors cannot, at the current fee, be able to implement everything that they need to get this going, as you will have to pay out of your own pocket at the end of the day to the salary of most probably the nurse that you would like to employ.
Well, SAMA says it will continue lobbying government.
Remember, these 200 practices that we are talking about that has applied or in the process of applying will only be eligible for phase 3. National Department of Health are quite clear that in phase 2, they will only look at the big sites, like your big discounts, your big clicks.
Pharmaceutical group Clicks has already received approval from the Health Department. As part of the country's second phase of vaccination, only people aged 60 and older and vulnerable groups qualify. And registration on the Health Department's electronic vaccination data system, EVDS, is required. Meanwhile, the Dis-Chem Group says it's starting with 11 vaccination sites across the country.
5 in Gauteng, 1 East London, 2 Cape Town, 2 KwaZulu-Natal and 1 Free State. The capacity per day that we foresee and we're planning for is 500 per day per mass vaccination site. It's not within the Dis-Chem, it's near a Dis-Chem store, but it's not within a Dis-Chem store, so we can manage the volumes better. And we can, and because it's the Pfizer vaccine, it's a bit more cheap to manage that. And it's just easier if we have a selected space. So yeah, there's been a lot of planning and hard work for the last 2 months.
We have another 20 pharmacies coming online, but we've got 504 pharmacies in the pipeline waiting for the Johnson & Johnson vaccine. Because at the moment, the limiting factor is the cold chain requirements for the Pfizer vaccine.
MedScheme, which administrates the claims of 15 schemes, has reiterated that members have to register on the Health Department's electronic system.
You have to first register on the national EVDS system on the links that have been provided everywhere. And there's registration through web, the phone, call center, USSD. There are various platforms on which an over 60-year-old can register. When you finish registering, it will give you an SMS that tells you that you have been successfully registered.
More than 1.23 million people over 60 have already registered to receive the vaccine. So the department hopes to vaccinate 5 million people in this age group by the end of June. Criselda Lewis, SABC News in Johannesburg.